totally worth the wait, I promise.
All right.
So hi everybody, welcome to our session 2 of our Wellness Matters seminar series. My name is Jody Lane and I'm the COO here at Florida Center for Hormones and Wellness. And I just wanted to start by just doing a few housekeeping things. First of all, a few of you have asked, we do have a Facebook page. It's a closed not a Facebook page, a Facebook group. It's a closed Facebook group only open to those of you who attend any of our seminars. We send out emails to everyone who came to meet the panel, but I'm thinking that a lot of you didn't get them. They might have ended up in the junk mail because we send them through a system. So I'm going to go ahead and send them personally from my email address tomorrow, or maybe Monday. But you'll get them personally from me. All you need to do is just accept the invitation and then you'll be in the group. We live streamed the first session, but the rest of the sessions will be closed. So you actually have to attend in order to see the recorded video. And so that's what this is. We're recording it, and so you'll be able to see this. So feel free to just enjoy. If you want to take notes, that's great, but you will be able to watch it again. And it will be available inside that closed Facebook group, okay? Feel free to ask questions. Dr. Carrozzella is a very loose speaker, meaning that he has lots to say, but he's totally fine with answering questions. And so, write them down. Feel free to ask those at the end. And I just wanted to, for those of you who don't know who he is, give you a little bit of insight about who Dr. Carrozzella is. So Dr. Carrozzella is a 1978 honors graduate from Yale, subsequently earned his MD from the University of Cincinnati in 1992 with the honor of Alpha Omega Alpha. He completed his orthopedic surgical residency and hand surgery fellowship in 1988. After practicing as an orthopedic surgeon for 25 years, he switched his focus to the non-traditional medical specialties of hormone replacement, sexual health and dysfunction, and age management. He's an expert in hormone therapy, sexual dysfunction, and age management for both men and women. However, who he really is a man who is extremely passionate about everybody living their best life and being able to live to 100 with vitality and energy and passion, and he's committed to everybody having that for themselves, which is why we do these free seminars. You can find him in the community speaking to lots of groups, and we advertise in lots of magazines because we want everyone to know what's possible in your life when you have your hormones optimized. So without further ado, I bring the man, Dr. Carrozzella, to come tell you all about hormones and happiness.
So is you I can turn your computer on so it's like over there?
Yeah, sure.
So I can see what's coming up?
Absolutely.
Excellent. So, thanks so much for coming, and I'm happy to have you here. And I want to try to keep this a little bit informal, a little bit fun. So if anybody wants to interrupt me, feel free. This is really just going to be a little bit of a conversation, but I have a few things that I want to get across to you. I really want to talk to you a little bit about hormone therapy and why it's essential, and it's not an elective thing, and it's not just to feel better. That there's so many things that are important about hormones that it's really a way of living. So what I want to do is talk to you about hormones and why they're for your happiness and your health. So a little bit about us. We're the Florida Center for Hormones and Wellness, and we're dedicated to improving the health, wellness, and vitality of the residents of Central Florida. And we're going to do this by being the leading provider of hormone optimization therapy. And we're going to do it in a way that is with education, using the literature, and doing the things that are necessary to make sure that we're giving you the absolute best of medical care that's in the literature, that's documented. We want to have a great environment where people are happy, where they feel invited, where they feel included. And that's the way we kind of conduct things. We really have a conversation in the office rather than that typical doctor-patient, what's wrong with you kind of thing. We want you to be involved, and everybody is directly involved. And you know what? I can't do it alone. It's all about my staff. You're going to find that we all do this together, that we have a lot of fun, that everybody supports everybody in this office, and it's really about providing something that's really unique. It just does not happen. We are committed to providing personalized, individualized care that really makes a difference. So, what are hormones? Okay, hormones are these little funny things that float around in your body and they cause an effect. And if you look at the real definition, it's a substance that's produced somewhere in your body that goes somewhere else in your body and it causes an effect. And that's about it. Okay, well, the ones we generally want to talk about are these four up here. These are the major ones that we do. Of course, there are quite a number of others that we will look at and talk about as we go along, but these are the four that make the biggest impact for the most amount of people. And for those that want to focus in on one particular area, these are the four that we talk about. Everything except the triiodothyronine, which is basically one of the components of thyroid, are called the sex hormones, and then the other one is basically the thyroid hormone. So let's take a step back and look at things a little bit, okay? Because we hear all of these things about hormones, and there's all of this confusion about what's good and bad. And one of the things that we wanted to make sure that we covered tonight was talking about some of the myths that are out there. And some of the myths are generated because far too many people confuse the natural or the biologically identical hormones that we use every day, the ones that actually are in your body, that cause the effects that we want to have, that make us healthy and vital. They confuse those with the synthetics, or the ones that the drug companies make, because that's the way they can make money. They can patent these things and no one else can use them. So let's understand what that is, okay? So don't get too hung up on the chemistry and all of that, but just take a look at this. This is what a testosterone molecule looks like, okay? Now here's a synthetic hormone called methyltestosterone, okay? So this is one that is made by the manufacturer, by the pharmaceutical company, and we can see that all they did is tack on this what's called a methyl group. And by doing that, they made this very unique compound that nobody else has ever seen, and now you can go to the patent office and you can patent it. Well, it's the same thing that happens with estrogen. So you've got estradiol, which is a natural occurring hormone which exists in your body. Your body knows what to do with it. It knows how to use it. It knows how to metabolize it. It is just perfectly normal for it to be there. But then they go ahead and create this thing called dihydroequilin, which I can't even hardly pronounce. And all they do is take that little OH group and they turn it into a double bonded oxygen. And lo and behold, we have a unique substance that's never been seen before on the face of the earth. And yet it's got to be able to be patented, okay? Well, that has consequences when you put these things into the body. And the same thing happens with progesterone. And this is the bad guy. This is the one that causes all of the bad problems that you've heard about. And if it weren't for this guy over here called the medroxyprogesterone acetate, which again substitutes that chemical structure on the end, and it makes it a unique molecule that then becomes patentable, this is the one right here that has caused all of the headaches and has caused millions and millions and millions of people not to get hormone care. This is the one that has got everybody up, all of their panties in a twist. Everybody's upset and worried about this because this is the one that causes all of the damage. Okay, so what do hormones do? They're absolutely crucial for life. If you did not have hormones in your body, well, we might have evolved differently, but the way it is, if you don't have hormones in your body, you're going to die. Okay? They regulate many, if not all, of the bodily functions. Anytime they're low on hormones, you're going to probably be sick or you're probably not going to feel well. But they do many, many different things to the body. Okay, you didn't bring over Jody, I revised it. I meant to tell you that I had revised it. You had downloaded it. They do all of these things in the body, and there's cardiovascular, brain function, bone health, and all kind of different things happen or are healthy when we have hormones. Okay, so what is hormone therapy? With hormone therapy, you ought to be in this office from time to time and just see the remarkable, what I call absolutely stunning effects that we see when we treat people. They're life-changing, I'm telling you. If you're not getting your hormones balanced, and particularly if you're having a lot of symptoms, it's life-changing. Not only that, if you're feeling okay and maybe you're around the change and in the middle of the 50s, you want to preserve that, okay? You want to preserve that health and vitality. And I guarantee you, if you don't keep your hormones balanced, your decline is going to be a whole lot faster than somebody that does balance their hormones. So we cannot live a healthy, vigorous life without hormones, and everything that we do, as I mentioned, is based on evidence-based medicine. It's really incredible that this stuff is misunderstood by everyday medicine. Uh-oh. So what are 5 things that are going to happen? 5 things, at least, that you can expect. You're going to have better sex, you're going to have better energy, you're going to be able to control and manage your weight better. And I want to be really clear. Hormones are not a weight management therapy. Hormones will allow your body physiology to be properly aligned so that when you do the things that are necessary, we can attack the weight. Because I'm telling you, other than hair, weight is the number one thing that I hear secondary to the hormone symptoms universally. I'd say that well over 50% of the women and the men that I see worry about their weight. How many people in here, well, I'm not going to ask for a show of hands. How many people in here know somebody that's after age of 50, they started to complain about gaining their weight? Okay? Everybody has. I hear it every day. Well, I was doing really good and I work out and I eat a clean diet and I do everything just the way I'm supposed to, and then I got to 50 and I stopped having my cycles and I gained 12 pounds in the last year. And I'm going, what happened? I didn't do anything. I'm like trying really hard, and the harder I try, the worse it gets. So hormones and weight go hand in hand, but if you get your hormones balanced, you still need to do the things that are necessary to lose that weight. And we have a program for that too. We've now learned some really wonderful things about weight. It's going to be a subject of another conversation further down the road in our Wellness Matters series. That one's going to be really exciting. It's going to be revolutionary, and it's going to totally upend the way that you think about weight management. Get this. People who have their hormones balanced have lower rates of cancer. How many people in here have heard the opposite? Okay? Everybody has. That's what we think. I hear it every single day, and it's frustrating as anything. Heart disease. How many people heard that hormones cause heart attacks or strokes or blood clots? Sure. Again, I like to call it fake news now. There's fake news in the real news. There's fake news in the medical news. Okay? So, what we're going to do is we're going to talk about sex. Who's interested in sex? Anybody? Anybody interested? No one's. I see a lot of no hands going up over here. You know, listen, God gave us this gift. Gave us this gift of an ability to be truly intimate with someone where you actually get to share your physical being with someone else. And I see it every day. It literally brings tears to my eyes when I'm able to be involved, and I'm blessed. I'm one of the really unique individuals who God has given the privilege of being involved in people's everyday intimate lives. And to be able to have the impact that I have is truly phenomenal. Think about it. Before we started to understand hormones, and as we started to expand our life cycles, that is, as long as when we started to live longer with all of the advances in medicine, we would go through menopause, we would go through andropause, or the lowering of testosterone, or the hormone imbalances that men have, and we would start to lose our ability to be intimate. And we went on other things. We traveled, we had fun, we grew up the grandkids, and all these things. And all that's great. Don't get me wrong. I mean, those are wonderful things in life. But imagine this. You go to school, you work hard, you raise your kids, you make some money, you get to this point in life, you're starting to feel lousy, you go to the doctor, who restores your hormones, and then all of a sudden, this whole new world opens up of physical intimacy that you thought was not there. The joy and the happiness that I get to see in this office when we restore sexual intimacy is something that's really cool to see. So what about sex? Hormones are not all about sex, but I'm going to tell you what, it's really a fun part of life. Okay? Most women and men will undergo some substantial sexual decline as a result of hormone imbalance. And we've all seen the anomalies. You know, the 75-year-old guy who's never had a hormone in his life, and he's got 6 girlfriends, and if you go up to the villages, you see it all the time. Okay? But the reality is most people are going to decline, and they just accept that as a part of aging. It doesn't have to be that way, okay? Okay, so what happens in women? It's a normal when the hormones decline to see a decline in sex drive. Responsiveness, not only does the drive go down, when you finally get around to doing it, it doesn't feel good. So you don't have the drive, it doesn't feel good. Who wants to have sex under those circumstances? And then it's dry, so it doesn't feel good, it hurts, it's painful, it bleeds, it's terrible. And then there's, you get thinning and changes, it just is not as big and all of that kind of stuff. So you have pain, and it leads to a loss of intimacy and ultimately relationship issues. I remember when I was doing this in the beginning, one of my best friends is a Baptist preacher. And he and I are really, really tight, okay? And we sit down and we talk, and we're almost like primary confidants, okay? And when I got started in this, 8, 9 years ago, I sat down with him. I said, oh my God, I'm going to be doing the sex stuff, and I'm going to sit down with a Baptist preacher, and he wants to know what I do. And so I'm sitting there having lunch with him, and I go, well, I'm doing this new thing. And he says, I'm going to be dealing with sex. He says, oh my goodness. He says, what a blessing you have. He says, do you know what the number one cause of marriage breakup in the 50s and the 60s is? He says, I've been counseling men and women for over 30 years. And he says the loss of intimacy is a big problem when it comes to relationships. So not only do I get to allow people to restore the fun of that physical intimacy, I'm actually blessed to be able to help people maintain their marriages. And that's just something that, for me, is really, really fun to be involved with. Same thing with men. Decreased sex drive, decreased responsiveness, decreased morning erections, reduced size, erectile dysfunction, loss of intimacy, and again, relationship problems. So what do you do? Most women will respond very favorably to hormones. It can be really simple. Now, there are complex cases, and there's other things to do, and one we're going to get into later in this series, exactly what we can do when we restore hormones, and then you still have functional physical problems with intimacy, that once you're there, you got the drive, and then there's performance issues. We're going to talk about that later in the series, okay? But it all is about symptom improvement, and you want to know what? There's no dangerous side effects. Matter of fact, nothing bad is going to happen when you do hormones. Nothing. Now, I will tell you that when you use hormones, you can get too much of what they do, okay? If you use too much estrogen and you don't balance it out properly, you could get some breast tenderness, you could get some bleeding, okay, you can get some swelling, but that's what the estrogen does, okay? It doesn't cause cancer, it doesn't cause blood clots, and it doesn't cause heart disease. That comes from the synthetics, that comes from the Premarin, that comes from the Provera, that comes from the synthetics, okay? So when we're talking about hormones, the literature is absolutely clear. And anybody that tells you otherwise doesn't read the literature with a detailed understanding of the nuances, because they'll try to deceive you. I'm telling you. Imagine this. Suppose you're a cardiologist, and I don't want to get into conspiracy theories and all that, but I just want to throw this out there for thought. And it's clear that when you use testosterone in men, that you lower the risk of heart disease by more than 50%. Good deal, right? So can you imagine from a business standpoint, you're a cardiologist, and you say, I got this thing here, if I promote it, I'm going to lower the risk of heart disease by 50%. Is that good or bad for business? I don't know. You answer that question. But I can point to a couple of articles that when you analyze them, you go either they were stupid or they had an agenda. There's no other reason to understand why they did what they did in an article. And there's one that comes to mind that's just a profound example of a misleading article that's designed to steer people away from hormones. And I can't come up with a reason why they would write that article. Not alone the authors write the article. How in the world would the editors at a peer-reviewed journal allow that article to be published? Other than we've got an agenda, or we've got this thing called confirmational bias. Has anybody heard that phrase, confirmational bias? Confirmational bias is a big problem in medicine. So here's the way it works. You go to medical school and you hear that testosterone causes prostate cancer. And it gets drummed into your head and gets drummed into your head. And for 10 years in your practice, that's all you hear. And then all of a sudden, the papers start to come out that say, no. Actually, quite the opposite. When you're testosterone healthy and your prostate is nice and healthy, your rate of prostate cancer goes down. Well, you haven't read it, you haven't heard it. You said, well, I heard that in medical school. It can't possibly be. You don't read the articles to understand that, and you just go, nope, that's not true. Okay? Or you actually read an article, and you're so convinced in your heart that you can't receive what the article is trying to tell you. So that's what confirmational bias is. Think about it. Many of you may have things in your head that you've heard, that you hear something else that is actually true, and you go, wait a minute, that can't be true, I heard this. Okay? I mean, it would be like if someone told you tomorrow that there's life on Mars. You go, no, there isn't. But yet you've got all of the science in the world. They've been up there with the probes, and they actually saw some life. You would sit there and go, nope, there's no such thing as life on Mars. And it would be hard for you to believe. So the same thing happens in the medical community when it comes to understanding these things. Okay? So the same thing for men. is similar to women. Men do great on testosterone. Okay? They do very, very well. They feel good. They get better. I mean, imagine being 54 years old, okay? And I've got a guy, he's a big executive at Disney, and he comes in and he says, geez, he says, I'm really having some problems. And I go, what is it? He goes, I used to go to my meetings and I was like, there, I'm with it. But now the younger kids are blowing me away. He says, I can't stand it. I'm falling behind. I feel like I'm going to get fired. And I said to him, I said, well, okay, well, let's kind of do a couple things. And we got him on testosterone. And he came in 3 months later. I said, how you doing? He says, I'm back on it. He says, thank you. You've changed my life. I mean, who wants that? Who wants to have their life change? Who wants to look at this inevitable decline that's accelerating year after year after year? Or who wants a little bit of, I'm good, I'm vital, I'm vigorous, I'm living that great life to 100 years old? That's what we want to do around here. We want to do that, and we can restore that. So we get symptom improvement, no dangerous side effects. Again, energy. How many people see the couch in the afternoon and it says, the couch is calling my name? Okay? I hear that every day. Well, I get to about 3 o'clock in the afternoon and I got to take a nap. Do you know, I mean, people are taking naps. I never knew so many people took naps. It's an incredible thing. I go, well, what? So, yeah, I got to go take a nap. So, but then we get them fixed up, and then all of a sudden, I'm ready to go. What do I want to do? Well, I'm ready to go. I'm going to go to work. I want to go and party tonight. I'm good, okay? Listen, I'm 62 years old. Do I like to go home sometimes and go to bed at 7:30? Yeah, I work hard. We all do. But I get through my days. And then I get to party too. Like, I got a big event tomorrow night. I'm going to get up at 4:30 like I usually do. I'm going to work all day long. I'm going to go out to my party. I'm going to have a great time. And I'm going to get up on Saturday morning. I got to go over to Tampa to teach something about hormones again. And I'm going to be fine because I know I've got that reserve. And when I can do it, I can do it. And I don't dread it. I don't have to bull through it. I get so many people go, you know what? I'm an entrepreneur. I've got a big business. I've got to make things happen. I go, well, how do you do it? They go, I just get up and I do it. And go, how do you feel at the end of the day? Miserable. Okay, well, that's not a good way to feel. I go home at night, I have a glass of wine, I feel really good. If I want to go hang out with my girlfriend, it's great. I have a good time. Life is really, really good right now. And I'm 62. I mean, I feel good and I'm active and I'm not too much overweight, maybe only about 5 pounds, but I'm working on that with some of you who are in our program. So the couch is calling my name, okay? So what are our big things that cause fatigue? It's thyroid and testosterone and then nutrients, okay? And so we do all of that here to try to restore that and make people healthy and vital. Weight. Anybody want to lose a pound or two? That just about everybody does, okay? You start to have those hormonal changes and that weight just comes on. It's really, really a frustrating problem. And the people that are into health and wellness, they just can't get rid of it. It's there, and we need to deal with it. As much as 10% of the people are obese, that's with severe body mass index, okay? Many, many people, more and more people are getting overweight. And we're going to get into this in another one too. This is another one we're going to talk about. Going to be really exciting. It's about how crucial sugar metabolism is to weight management. So how many people think that if you eat less fat and you exercise, that's the way to control your weight? Really good. I'm impressed, okay? The new literature, the new understanding, what's going on in the world is about sugar metabolism and insulin resistance and insulin resistance. And when we can get a handle on that, we can give you the tools to lose your weight. Because, well, I don't want to give away the secrets of the next lectures, but if your insulin is high, you cannot mobilize the fat. You have to reduce your insulin. And we've got strategies and we've got things that we're doing. And I'm going to tell you what, since we started bringing that into the office a few months ago, we're seeing some pretty spectacular results. Okay, so we all know that hormones cause cancer. Who's heard that? Everybody's heard that. Okay, they don't. Okay, the synthetics do. When you look at Premarin and Provera, and it's particularly the Provera, that medroxyprogesterone acetate toxic chemical, which everybody calls progesterone. Okay, and I fault the editors and the literature to a large degree, because early on, they call these things progesterone, and the reality is there is this group of hormones called progestins. Progestins is like a group, and within that group you have progesterone, but you also have a lot of the synthetics. Some of the synthetics that are in birth control pills, and then the MPA, which is the one that they use for menopause for women for 40 years until things went south on NPA in 2002 with the Women's Health Initiative. And so when you talk about, but what ended up happening is instead of staying with the proper terminology and calling everything progestins, they started to extrapolate the name of progesterone and encompassed everything. And so everyday doctors who don't really understand or don't read and study the way that someone like me does have lumped all of these together. And so when they hear the word progesterone, they think of something bad. I just had a patient yesterday, the other day we were talking about. She went to the doctor and was having some problems, and they diagnosed a liver challenge. And she said, well, I'm on these hormones. And they said, oh my goodness, it's the hormones. That progesterone is causing you liver damage. There's not one reported case in the history of mankind that has ever said that giving someone progesterone will cause them a liver problem. Okay, but the doctors today are so ingrained in this thought that hormones are bad for you that if you stub your toe, they're going to blame the hormones. And I'm telling you, it's true. I see it every single day. It's like going like, huh? Where do they come with that? It's like, I had a dentist. I heard one today. I saw one today. Said the patient called in and said, well, I had an acute necrosis of my jawbone, and the dentist said that it was the hormones that you put me on. We're like, what? It's like, oh no, that was on my form. It was on my form this morning. We're like, what? How can you get that? Where does that come from? Show me the article that says that hormones can cause jaw necrosis. Most likely what happened is this woman is a little bit older. She was put on a bisphosphonate or one of those osteoporosis medicines, and she got the jaw necrosis from that because that's what it's known to do. Yet because she's on the hormones get blamed because they're the root of all evil in the world. Okay? So they don't cause cancer. Matter of fact, anybody think that hormones could possibly prevent cancer? Yeah, they can. Because when you look at testosterone, and you look at some really wonderful work coming out of 3 independent sites around the world, including Dayton, Ohio, and Adelaide, Australia, you can see that when you give women testosterone, as much as 75% reduction in the risk of breast cancer. Now, who wants that? What's today? What's the date today? What happens in like 13 days? What happens? What month is it in 13 days? Okay. Do you think anybody is going to talk about testosterone reducing breast cancer 75% in October? No. Okay, so if you had a substance that made you feel good, increased your sex drive, made the sex better, made your bones strong, protected you from heart disease, protected you from cancer, and protected you from cancer, do you think that would be a drug that like everybody would like run to the drugstore to get? Okay, well yeah, and we've got it. It's called testosterone, and yet everybody thinks it's bad for you. And I want to see one article that even says that testosterone causes cancer. It's not. Any articles that show that it causes cancer are the ones that talk about Premarin and Provera and their risk of breast cancer. Well, Premarin and Provera cause breast cancer. Well, testosterone is a sex hormone. It must cause cancer too. Whoop. Okay. I don't know. I don't know how they do it. I don't know why they do it. Okay. Women, breast cancer, men, prostate cancer, same thing. Has anyone ever heard that when you use testosterone in men, it's like throwing gasoline on a fire in terms of flaring up the problem? Yes, you have. Yep. That comes from a study of one person. So back in the 1930s, there's this guy named Huggins, and he was up at Mass General, and he was studying prostate cancer, and he had one patient, one. He did an orchiectomy, he did remove his testicles, the prostate cancer got better. They gave him testosterone, and the prostate cancer flared up, and he died. He wrote a paper, got published, he won the Nobel Prize for that. And from the 1, how many people think 1 is a good series? No. Okay, it's crazy. And from that, testosterone was bad from the 1930s until really just about 3 or 4 years ago. What did we find out 3 or 4 years ago? We found out that we can now give men testosterone 1 month after their PSA goes below 1. So you get prostate cancer, you get treated, and there's some really, really cool treatments about prostate cancer. You talk about impotence and all of this erectile dysfunction that used to be a problem. You got localized, small focused prostate cancer these days. It's amazing what can be done and preserve sexual function. But nowadays, you treat that prostate cancer, and within 30 days, you can resume your testosterone and have no risk of recurrence. In fact, the literature now shows that when you're balanced with your testosterone and estrogen, that your risk of recurrence drops precipitously. Matter of fact, you know what they're doing in Boston right now for men with stage 4 widespread prostate cancer? High doses of testosterone and estrogen, and it knocks it out. These people are living longer and doing better, and they feel good. So if you know anyone who's got prostate cancer and they put them on that Casodex and Lupron poison garbage that's making them miserable, tell you what, it's amazing. So it's not a cancer causing, okay? Look at this. Who gets breast cancer? Women who are young and have lots of hormones, or women that are older and have no hormones in their body? Hello? If estrogen caused cancer, this graph should be the opposite of what it is, right? Okay, same thing, okay? It's like it's craziness, okay? Same thing with, okay? Heart disease, okay? Everybody's sure testosterone is going to cause blood clots. Hormones are going to cause blood clots. You're going to have a stroke. You're going to have a heart attack. There was a great study in Utah. They looked at about 1,000 people who have known severe heart disease, previous heart attacks, stents, whatever, all comers with known heart disease. They divided them into 2 groups. It's a great study. It's called a randomized prospective double-blinded controlled study. They put them into 2 groups, and they looked at it. Guess which ones had the lower rate of recurrence? If you would think that someone was going to get a heart attack with testosterone, it would be somebody already with heart disease, right? Guess which ones did better? The guys who were on the testosterone. Okay, that's one of the best studies out there that goes against that. So it's the number 1 killer of all women. Before menopause, before menopause, the risk is 1 in 7. After menopause, it's 1 in 3, so more than doubles. But it's clearly linked to a decline in estradiol. And when you restore the estrogen, they get better. Okay? So, let's just talk really briefly about normal and optimal. Who thinks that we need to put blood levels to normal? What does normal mean? Does anybody know what normal means? No. Do you know what normal means? Do you know what normal means? You? John?
Stopped using that word a long time ago.
Yeah. Normal means they get 1,000 people your age who feel just like you do before you started your hormones. They draw their blood. They do it out there. They get what's called a normal distribution. Anybody know anything about statistics? So you get a normal distribution. It's called, everybody heard the bell-shaped curve? This bell-shaped curve, and you get the mean or the average. And then what you do is you calculate this thing called the standard deviation. And you go 2 standard deviations up or 2 standard deviations down. You chop it off and say, these are normal, these are abnormal, these are abnormal. Did anybody hear anything about quality in there? No, nothing about quality. Quality is what's important when it comes to hormones. And you can clearly see that when your levels are low, you don't feel good, and your levels are high, you feel good. So there's a graded response that goes up with increasing levels that has nothing to do with whether or not you're in 2 standard deviations. And there's all kind of other things, environmental influences, toxins in the environment, pollution, hormones that you eat, inflammation in your body, all kind of things that affect your body's ability to respond to a hormone. So the amount of hormone that you need, or the amount of hormone that you need, or the amount of hormone that you need might be different. And so you go for an effect, you don't go for a level. And so that's what I mean by optimum. I'm going to optimize you so that you feel good. The numbers are important. We measure them, we look at them regularly, but we correlate them with how you feel. And how you feel dictates more about what I do to adjust you than what I do to treat you, okay? So the amount of hormone you need is very different than the amount of hormone someone else. Normal ranges are based on a statistical measurement. And the optimal level is what the literature says. That is, what do I know is going to cause a good physiological response at some point in time? Let's look at this. With estrogen, for example. Women come in with their estrogen levels typically around 20 or not even measurable. Well, what do I know about estrogen? I know that if you're below 100, your risk of heart disease goes up, osteoporosis, How many people think that dementia is related to estrogen or estradiol? Of course it is. There's a great study in Utah where they looked at, goodness, I think it's several thousand people. I think the number might even be 10,000. And they found that if you took hormones, you reduced your risk of dementia by 80%. Do you know that dementia is the number one worry of most people growing up today? That we now have so many advances in cancer that people, we're still scared about getting cancer, but we're more comfortable that we'll have cancer and survive and do well than we are about being demented and being totally out of it. I mean, I think that's the number one fear that most people have today, and yet you can reduce the risk of dementia by 80%. We're spending gazillions of dollars trying to find the treatment. The treatments don't work. So let's not make it happen. Let's fix it before it even starts. But no, hormones that cause cancer, they're bad for you. They're really bad things. And everybody knows it. The Women's Health Initiative showed it. And then besides, they're just bad because I know it because they told me that in medical school. Okay? So anyone who wants to maintain their youthfulness, vitality, their energy, engagement, sexuality, overall health, wellness, must optimize their hormones as they age. Who wants all of that when you're 60? Okay, we all do. Okay? I want to live to be 100, and I want to be just as happy and vital and as excited and have as much energy and passion as I have today. That's what I want. And that's what I want for every single person that walks into this office. I love my patients, and I will do anything to make my patients healthy and happy. I get so excited when I see a good result. It's like I go crazy. I come, hey, Jody, look at this one, look at this one. It's so much fun. The medical literature speaks loud and clear that hormonal decline is associated with all of these bad things. We can't stop aging, but we can certainly manage it. And there is really no contraindications. People come, well, I've got this problem, I've got that problem, I've had skin cancer, I've had this, can I do this? There is really no reason why hormones should be used in virtually anybody. I mean, diabetes, you ought to see what we can do with diabetes and cholesterol by getting hormones fixed. It's incredible. So it can be as simple as complex as you want. I guess some people come and fix my hormones, I don't want to do it, or some people come in and go, I want to do everything. We get into cholesterol, we get into sugar, we get into micronutrients, we get into weight, we get into sleep. We can get into a whole bunch of things that'll really do it. But the key is customization and individualization. And that's what we do. We take the time and we spend the time with you to learn about you, to learn about what's important in your life, to learn about the things that you want to do so that we can help you fulfill those dreams. Everybody that comes in, we sit down and we put a little orange piece of paper on the table. So I want to know the top 3 things. How many times you go into the doctor and he says, oh, your blood work looks good. See you later. Okay. Yeah, your blood pressure. So I didn't come here to talk to my blood pressure. I want to do that. I said, I know my blood pressure is fine. I want to know each and every time someone comes in the office, are we addressing your needs? Because I don't want to just look at your estrogen level and say your estrogen level is fine. You go, but doc, I'm not sleeping. Oh, and if I didn't ask you, if that was a big deal, I wouldn't have. You go, God, I went in there, I wanted to talk about my sleep, and all he told me was my estrogen level was fine. No, yes, ma'am.
I have a question. So when you guys do customization and individualization, which is probably blood work, I'm assuming is part of the whole thing, is it?
Well, blood work is important.
It's
yep.
part of it. But like, what do you guys look for in the blood? And I don't know if you get to it later, but I'm just curious. Like, what do you look for primarily?
Well, I can pretty much tell you what your blood work is going to be before we start. Okay? So you come in and tell me what's going on, I know what your blood work is going to look like. Okay? So the blood work is useful for establishing what I call a baseline. And then we do something, and then you get better, and we look at your symptoms, then you get a hormone level and go, okay, this is your number. Your number, not the number. Okay? So that's what the blood work is used for. Okay? So I'm going to open up for questions here. I'm almost done, and we're going to talk about that. Okay? So the blood work is important to understand where we are and where we're going. It's not important for me to tell you what you got. I mean, you know, if you're 53 years old and you haven't had a cycle in 2 years and you're having hot flashes and night sweats and sex hurts and you've got no sex drive and you can't remember where you put your keys last night, you're in menopause, okay? I know what to do. You need estradiol, you need testosterone, you need progesterone, okay? I don't need blood work to tell me that. And anybody that doesn't understand hormones the way that they need to in order to be an effective hormone doctor, right? So I could give them to you, I can make you feel a lot better, and I could really treat you all the rest of your life without blood work, okay? But we use the blood work. Let's say that we treat you and we get you feeling really good, okay? Now I get your blood work and I find out that your estrogen level is 110 and you're feeling perfect. And we go and we go and we go. And 2 years later you come in and go, Doc, we did a treatment last time and I don't feel very good. Something's not right. And we get your blood work and your estradiol level is only 25. Okay, well what do I know? I know that you're happy at 110. We did a treatment, you're only 25. It means that whatever we did last time didn't take this time and we need to get you back up to 100. So that number that is yours individually gives me the guidance to tell me where I need to be once you're healthy. I mean, I could continue to treat you all along. It just gives me that ability to understand when there's a bump in the road, what we need to do to correct. Does that make sense? Okay. So there you have it, okay? Beehive. Biologically identical hormone optimization therapy. Better sex, better energy, weight management, lower rates of cancer, lower rates of heart disease, and an understanding of the difference between all. Who are appropriate candidates for Beehive? Everybody. Okay? So here you have it. That's all I have to say. So it's time for questions. I want to see if I didn't cover anything. Yes, ma'am.
Okay, so what forms of replacement therapy do you have?
I do just about everything, okay? My favorite is pellets. I get the best results when I use pellets.
Okay.
I can do, one of the nice things about me is I've been trained in all of them. I can do all of them. I can do creams, I can do pills, I can do shots. I can do everything. I'm always updating, keeping current on what's going on so I know what to do. But my favorite by far is pellets.
Are they manufactured here in the States? How would you get?
They're manufactured in the States by what's called a 503B pharmacy. 503B pharmacies that I use are regulated by the FDA. They're very closely monitored. Their manufacturing standards are exactly the same as any major pharmaceutical manufacturing company.
Well, I gotta tell you, I love pellets. I was on pellets for 11 years. And when I moved here last year from Michigan.
Mm-hmm.
No doctor in Florida does pellets. Gynecology anyways.
Well, yeah, you know how it works with ACOG, right? So ACOG is against hormone therapy, okay? American College of Obstetrics and Gynecology. So here's how it goes. Wyeth, now Pfizer, they provide a lot of what? Do you think they give to ACOG to run their conventions and do whatever? A lot of this. So ACOG is out there going, goodness gracious, we're getting so much pressure to do hormones on women. We got to do it. So, the president of ACOG says, okay, well, this year we're going to put a hormone class in our annual meeting. And so they get the hormone class done, and word gets out. And the president of Pfizer calls up, and he says, hey, Bill, this is Joe over at Pfizer. He says, yeah, what's going on? He says, well, we're doing our budgeting this year, and we're trying to figure out where we're going to put our money, and who we're going to support this year in educational. And, we're just trying to figure out. I said, I hear you guys are doing a seminar on hormones this year. He says, oh, yeah? He says, okay, good. I just want to know that because we were kind of thinking of shifting some of the money over to cardiology. And, I said, no, we're going to cancel that seminar. Oh, great, good. Then we can keep your funding just the way that it was last year. Okay? Is that right? No, but it happens. That's what's going on. So the gynecologists are you would think that of all of the people that would be interested in women's health, it would be the gynecologist. It's stunning to me. I mean, it's just stunning.
It depends on the state, I think.
What's that?
It depends on the state, because I had a great gynecologist in Michigan that was part of the anti-aging program, and he was giving me pellets for 11 years.
It depends on the doctor.
Yeah.
Yeah, it depends on the doctor. It really does. The doctors have to open their mind and be ready to receive the new information that's out there.
Right.
And if they do, then you're going to get a doctor that cares and is interested. I mean, you can't run around in the world with this confirmational bias blocking you from learning new information. If you're a scientist, you have to be open to understanding what the science says. You have to receive the science. You have to be able to critically analyze an article. And one of the great things about what I do is I go to these mastermind groups. I've done it in the past. You try to sit down at your desk and you read your journals as they come by, and they make your head spin. Okay? They really do. And trying to sort out the good articles from the bad articles can be very, very difficult. But when you sit down in a group and you talk about these articles and you pick them apart line by line, and when you're in a group and someone knows that, oh yeah, Jim is over there, he gets $1 million grant from Pfizer. Okay, and he wrote an anti-hormone article. Okay, well you go, okay, well, it doesn't necessarily mean that he's biased, but it makes you want to pay a little bit more attention to the article and make sure that you're looking for bias. as opposed to Joe over here who's just got a little medical practice and he believes in hormones. He put together a study of 1,000 women and he's got no financial. Well, I mean, that study is going to be, you're going to be less concerned about bias in that study. Okay, so a mastermind group allows you to sit down and talk about these things in a little bit more detail and get a lot more interaction. And we have a monthly journal club every month where we look at least 5 different articles and pick them apart line by line by line. Okay, sometimes you can miss what's going on. Do I have some time? Can I tell the story? Yes, ma'am.
A quick question about the pellets. How do the pellets work versus tablets?
In my opinion, the pellets are the best, okay? The tablets require your gut to absorb them. And your gut goes through variable stages of absorbability depending upon what's going on in there, depending upon your bacteria, the amount of inflammation, and what else you've eaten that day. So all kind of different things. So I do oral therapy, okay? All of the studies with estrogen that are major NIH, National Institutes of Health study, use oral estrogen, the one that supposedly causes blood clots. If there's not one study that shows when you use oral estradiol or other blood clots. There's a lot of studies that show when you use estrogen, that is Premarin, okay, that show blood clots. And so estrogen, Premarin causes blood clots. Well, then we can't take any chances estradiol must too.
Where do the pellets go?
They go in your backside.
It's a pellet.
It's a pellet.
Like a
It's a little grain of rice, about that big. It's really tiny.
They make a little incision.
They make a little teeny poke hole about that big.
I've been taking the oral compound for years and I've never had a problem.
That's great.
Just
I mean, that's
heard
great.
about the pellets, I just don't.
Yeah, that's great. I mean, oral therapy is, I go to my mastermind groups and so many people do orals, okay? And that's great. And some people do just fine on it. One of the beautiful things about the pellets is, so every time your heart beats, it picks up a little hormone, okay? So when you take orals, you get the same amount every day. So imagine now you want to go to the gym and work out and you need more hormone. When you get the pellets in there, you got more heartbeats, you got more hormone. So they're almost like on demand. And universally, when you talk to the women that have been on the various different things, either whether it's the creams, whether it's the orals, or whether it's the pellets, almost universally the women that have been all three say that the pellets feel the best because it has that almost on-demand capability. I've been on all different ones. I've been on shots, I've been on creams, and I've been on pellets. And for me, the pellets feel the best because I can tell that difference, okay? I'm tuned into that and I feel that. Yes, ma'am.
So this is all very new to me, pellets, creams, all this stuff. I'm in my childbearing age range and just had my second child, and so your presentation was more geared towards like 50s, 60s. So I'm just curious, like of the clients that you have, how many of them are in their late 30s, 40s, and what are typically like, what's your approach when it comes to trying, I have a 6-month-old baby and I just want to like get balance.
Yeah, you're a perfect candidate, okay? Yes, I'd say 60 to 70% of my clientele is between 45 and 65. But I take care of women as young as 25 and all the way up to 90, okay? You're in a category where you may not need the estrogen, but you certainly are a candidate for the thyroid and the testosterone. And nowadays, women in their 30s and their 40s are experiencing hormonal decline at unprecedented rates. Same as men, okay?
Why do you think that?
We don't really understand yet. We just know that the hormone levels are declining and men and women are feeling, whether it's environmental, whether it's the toxins, whether it's genetics, whether it's what, but it's just happening. And I am seeing some remarkable results with women that are younger. I see a lot of women with a problem called polycystic ovarian syndrome. Okay, it's something that very few doctors know how to take care of, and the usual treatments here, take these birth control pills and it'll be fine.
Yeah.
That's it, okay? We really have an in-depth, very detailed program for dealing with polycystic ovarian syndrome. And we actually look at each of the 4 major components, which would be insulin resistance, thyroid resistance, low progesterone, and androgen sensitivity, and we address each pillar very specifically and very aggressively, and we can really make a difference in these women. We see some postpartum depression, and postpartum depression can be something as simple as restoring their progesterone. Women that are virtually on the verge of suicide, you boost up their progesterone levels, and within hours they're back to normal. Okay, it's dramatic what you can see with that. Okay, now I haven't had one of those, but I've heard many stories of that. I've had a number of postpartum women that have gotten substantially better on progesterone, nothing as dramatic as what I just told you. It is really remarkable. I see a lot of women in their 30s and their 40s that their libidos are gone. Anybody that's been on a birth control pill for an extended period of time, it's almost like a dilemma. Well, we invented these birth control pills so that you can have sex. You go on the birth control pill, your testosterone levels plummet, you go, well, I'm on the pill, but I don't want to have sex anymore. We'll go, why'd you go on the pill then? Well, I don't know, but I don't want to do it anymore. I mean, so there are a lot of younger women, okay, and so there's a lot that can be done, and typically women in that premenopausal age have things that we can do, and it's usually thyroid and testosterone, maybe some other things, looking at nutrients and all of that kind of stuff. Gut health is a big deal as well, and so you can get into some of that stuff and really make people a lot better.
It's a pellet.
Here's a pellet. Do we have an
200 milligrams, it's kind of big, but.
yeah? We don't have an inserter, do we?
Of course I do.
So here is here's what this is a dead, obviously it's a dead one, right?
Yeah.
So this is what a pellet looks like. This is a man's pellet, okay? So this is a man's pellet, and men will get anywhere between 6 and 12 of these. I got a couple people getting a few more, but that's it. And women get about half of that in total. Just
But how often?
typically the starting interval is about 4 months.
One every 4 months?
Yeah.
Wow.
Okay, it's about every 4 months, okay? And then the amount that you get in the interval that we do ultimately gets personalized, okay? I mean, everybody's metabolism is different, everybody works out differently, so everybody's different, so we will adjust and vary that dose, the dose and the interval depending upon each individual person. That's how we get to customize it.
Now, the progesterone's only oral, though, right?
Yes.
You don't have that in pellet form?
No, because progesterone can make you sleepy, and if we implanted a progesterone pellet and all of a sudden you reacted to it being sleepy, you'd be sleepy for 4 months.
Prometrium, or what do you, Prometrium?
Well, Prometrium is the brand name for true micronized progesterone. Progesterone available generic is generally not very good, because micronized progesterone goes through a process where they grind down the progesterone product into very, very, very fine particles that are uniform in shape. Then when you eat them, they get absorbed. Well, the progesterone that's made in China, that's generic for the most part, is not ground down. They push it through a filter, and as a result, the particle sizes tend to be quite different. And because of the different size of the particles, they're variably absorbed in the gut. And so when you get generic progesterone at the pharmacy, it tends not to be as good. So I generally recommend that we do the compounded. Now this is the inserting device, okay? So what we do is we make a little tiny nick in someone's backside. We put the inserting device in, we drop that pellet down right in here, and we take a pusher and we just push it right through.
Now, that's after you numb.
And that's after we numb, and that's about all the more that it takes, okay? And trust me, I'm amazed, okay? I was a surgeon for 25 years, and so I know anesthesia and how to do it. I'm amazed at what I see in this office. I mean, people come in that have come from other doctors, and they're all bent out of shape, and they're all anxious, and I go, what's the matter? And they go, it's gonna hurt, it's gonna be terrible, it's gonna be miserable, but I know I gotta do it. And they do it, and they go, what happened? I go, I don't know, I just did it. Every time I've had it done before, it hurt like crazy. I'm going like, okay.
The shot hurts worse, the numbing hurts worse.
The numbing is the worst. That first shot with the numbing, but I know how to handle anesthesia. I know how to handle. If I can do a hip replacement, I can put a little thing in and drop a pellet in. Okay, and I teach this stuff. So I mean, my vendor asks me to come. I'm actually teaching this weekend, so I teach new doctors on how to put. Goodness gracious! No, they're all good. No, all of the providers are very good, but yeah. Yes, ma'am.
You mentioned the lowering of breast cancer. What about other female cancers like ovarian, cervical? Do the hormones?
Ovarian is non-hormone sensitive. Cervical cancer is non-hormone sensitive. Yet everybody tells you if you've had them, you can't have hormones.
Yeah.
They have not one shred of literature that says anything. Okay, if it causes breast cancer, maybe it causes this too. So we don't want to take any chances. What do you mean you want to take any chances? So you're going to subject me to a 5 times risk of dementia and a 2 times risk of heart disease and a 35% risk of dying in 1 year after I've had a hip fracture? What do you mean you don't want to take any chances? You're taking crazy chances with my life because you don't know it's going to hurt me if I take it, because it's not. But you do know that if I don't take it, I'm gonna have all these things. Well, at least you're not gonna die from a recurrence of your uterine cancer, which you're not gonna die from anyway, because if you have stage 1 or stage 2, you're gone and cured once they take your uterus out. I don't get it, but that's the way it is out there. Yes, ma'am.
What about the addition of pregnenolone?
Pregnenolone, you know, pregnenolone is good for people that maybe have some cognitive decline. But the reality is some people react to the pregnenolone, and if you don't have true cognitive decline or taking it for that, pregnenolone is probably left to be by itself and not be. You know, that was just a thread on my discussion on my forum. Yeah, my forum recently. The pregnenolone isn't all it's cut out to be. Pregnenolone, if you know anything about hormones, it's the entry level into the hormone tree, and without pregnenolone, you can't make all of the cortisol and testosterone and all those things. But it just doesn't seem to be something that giving it back to people makes a big difference unless you have cognitive decline. Yes, ma'am.
Okay. So I'm here because I've done all of this. I did the cream. After a while, you don't work anymore.
That's right, because your skin gets resistant to it. Yep.
So I did do the pellet, and it's true what you said, that you're so scared. Like I can't even have my blood taken. I'm scared of losing. So I've had the pellet, and I'm like sweating, and my husband is sitting there. And when it's done, I was like, oh my God, I'm so stupid, because I shouldn't be scared, because
I get that every time.
Yeah.
They're all worried, and I tell them all the time. I said, "Okay, you're going to be really nervous." So we get in, and the rooms are set up here, and I said, "I get it. You're really nervous because you don't know it. When you're not nervous, you're scared, and you've had a bad experience with a needle or an injection." And then I do it, and they go, "I'm done. That's it."
but I'm still scared.
Yeah.
July.
I do that. I probably have about 4 or 5 guys and maybe about 2 or 3 women that I have to sedate them ahead of time.
Well,
So I'll do what I need to do.
So-
It's okay, but I mean, that's out of like 500 or 600 people that I take care of. So it's not, most people do just
When he's
fine.
done, I'll tell you.
What's that?
So you want?
I was asking which one did she like?
Well,
She said
the
all of them.
cream is great because it doesn't hurt you, right? But when I had the pellet done and I went to Minneapolis to see my sister, she was like, "Oh my God, Joan, this is like the best I've ever seen your face. You look so great, so wonderful." So if you're not scared, because I'm really afraid of that little thing there, I did it twice. But if you're not afraid of the little cup incision, then I would recommend it 100% to do
Did you
that.
try the oral one?
No, but I had the cream. And then another thing, there's like a local doctor here. The first time I went to get it done, and then I went back the second time, they couldn't find my dosage in the file for my estradiol. And I figured out that they didn't put it in the first time, they only put testosterone. So I kind of figured it out and said that this is what happened if you don't have it in my file, but you charge me for both, right?
Wow.
So I never went back because I think I was like really careless, because for me to go through all of that and not to have it dosed properly
The
at both
right
of them.
amount.
Yeah.
Wow.
So
That's
I'm
good.
here today because I'm not on the hormone right now, the cream doesn't work and I'm so scared of that. But I'm here because I'm doing the keto diet, and I've done it before, and I've lost, all my weight is right here, and I lost 10 pounds, and I'm doing it again, and I'm doing like everything you can think of. I just came from acupuncture, I have like really good massage therapists, everything. I've never cheated, but I haven't lost 1 ounce. And I know that my cortisol level is very high, and I know that can have a lot to do with it, so that's why I'm here today.
Yep, I hear that story all the time. Yes, ma'am.
Well, I'm here today because I went into menopause 20 years ago. I never did anything, had any hot flashes, whatever. I just went to visit my niece in Texas, and I was telling her, you know what, she just had a hysterectomy, she's fit. She's like, oh, I told her I'm so exhausted, and I put my head in the pillow and I'm out of here. You know, but for the past 3 weeks, I haven't been able to sleep, you know, like all this crazy stuff. And she's like, I think you need hormone, cause she has the pellet. She said it's the best thing that ever happened to her. I said, well, I'm gonna go and check it out. Then I was looking and I saw the thing, and that's why I'm here. Oh no, so now I'm getting like a hot flash here and there. I'm like, what the heck?
So remember, the most important thing is a lot of people think that the only reason why you need hormones is to stop the hot flashes and improve your sexuality. And the reality is that's great. I want people to be comfortable and happy and enjoy life. But the reality is there's so much more important. When I first got into it 10 years ago or whatever, that's all I went. I said, oh, this is really cool. I get to talk about sex all day long and all these things. But I quickly realized that it was a whole lot, that you actually really change the way people age. You have profound impact, and it's about heart disease, it's about cancer prevention, it's about vitality and energy, it's about enjoying your life more than just the sexuality and stopping the hot flashes. It's really, really a big deal. Yes, ma'am.
I just want to ask from a new, a new patient, what does that look like? You have a consultation,
Sure.
and then do you have recommended blood work?
Yeah.
And also, of course, how much does it cost?
Yeah, well, Amanda can answer a lot of that stuff about the technical, but basically, everybody gets a consultation, and we sit down for an hour and 15 minutes. I want to know everything about you. I want to know how it affects your life, what's in your life, what's important in your life, because I want to know what we want to get back to and exceed. Okay? So we spend a lot of time. And again, what did I tell you about blood work? It's important. But can I ask how old you are?
36.
Okay, I know what you need probably off the top of my head, okay? I know probably where you are, and I know one or two things I need to check off and make sure that you don't have, okay? And I could probably tell you what you need without your blood work, okay? Just by understanding what age group you're in, and then when you tell me what's going on. Now, I'll get the blood work, and that's gonna give me some clues, okay? Some further clues. And then we're gonna devise a treatment plan. I'm gonna lay that treatment plan out in front of you, okay? And there's a lot of facets to it. You can say, okay, I'm interested in this part, but you know what? I'm going to wait a little while longer. But the beautiful thing that I really like about dealing with younger women is that I can keep them on keel and healthier and more vital longer. And when they get to the menopausal transition, I can make it a lot smoother. Okay? Now, that actual time frame of transition can be really stormy, but it's I hear it all of the time. My women go, you know what? My friends are having a really tough time in the transition, but I've got my days, but it is a whole lot better with what we're doing here than what it would be. So beforehand I can do really good, afterhand I can do really good. In the middle of this change, it's a little bit stormy. We can certainly mitigate that storm a little bit, and then universally I hear people say, feel a whole lot better in the transition. So you start it, go to a knowledgeable doctor, you just continue it, and then they're going to help you through when you get into your 40s and then into your 50s, and you're going to live longer, be healthier, feel more vital. You're going to have a better relationship with your partners and all of that. It's going to be great. Yes, ma'am.
I know this sounds crazy, but women that are not on hormones, do the hot flashes ever end?
They do in some, they don't in others.
So it's kind of
It's a very individual thing.
Just curious. I can't imagine living with hot flashes, ever.
And we will talk about price at the end. Let Doc talk about money. So when you guys are all done, Amanda will come up and talk a little bit more about price, so that you guys leave knowing that stuff.
Yes, ma'am.
Do you believe there's any foods that can affect your estrogen level?
Not really. I mean, I think if you eat contaminated foods with a lot of estrogens and things in them, soy's not going to affect. No, that's kind of a fallacy. Really, it's going to be, if you really want to avoid, if you really want to keep your receptors clean, which is the issue, you want to eat organic, grass-fed beef. You want to, because what does fat do? It stores the toxins. Okay, so when you eat a piece of steak or a piece of meat with fat in it, all that garbage, and particularly the stockyard cattle, I mean, they throw garbage in there, they throw corn, whatever they can find that's going to make them fat, they put it in there. And all of those toxins get concentrated into the fat. So those are the things. You want to keep your inflammation down, okay? You want to keep your gut health up. Okay, all of that stuff is going to help your overall metabolism, because if you get there's bacteria in your gut that have what's called beta-glucuronidase in it, and one of the ways that you get rid of your estrogen is it goes to the liver, and it's what's called glucuronidated. So it takes the estrogen and puts on this molecule, and that way when it goes out into your gut, it can't be reabsorbed. But if you got bacteria in your gut that have the beta-glucuronidase enzyme in it, it'll cut that off, and then the estrogen becomes free, and the body goes, I want that, and it brings it back into the body, and then you can get too high levels of the estrogen. So you want to have good gut health is a very important thing to do, and we can look at that and deal with those issues too. That's why, everybody they say I recommend a good multi, because our food is garbage. We gotta replace the nutrients. I recommend a probiotic, a nice, healthy, solid, very well manufactured probiotic, a fish oil, and most often people are gonna be deficient in vitamin D and vitamin B12. And that's like my foundational supplement package.
So do you think that my problem is probably because of hormone?
If you're not losing, can I ask how old you are?
62.
I mean, if you can't lose weight and if you're truly being keto and you're not losing, 85% of the time, if you balance your hormones and you do what you do, you should lose weight. Now, there are certain things called metabolic blockades, usually toxicities, chronic inflammation and chronic infection can block your ability to lose weight, okay? Because what did I say about fat? Fat stores what? Toxins. Let's suppose that you were exposed to organophosphates. You live, next to a farm or a chemical plant, okay? And you don't have the ability to detoxify your body. That is, your body doesn't have the mechanisms in the liver to get that stuff out. It just recirculates. And so how does the body protect itself from these high levels of organotoxins? It stores it into the fat.
I believe my liver is not functioning properly. I don't go to regular doctors.
So imagine trying to lose weight and you mobilize that fat and you release those toxins. Have you ever seen someone who actually got sick when they tried to lose weight? It happens.
Yeah.
So there are people that get sick when they lose weight because they're releasing these toxins that they can't get rid of.
Or stress.
Overload the
Lot-
liver.
Yep. Cool. Alrighty.
Thank
Anything
you.
else?
Thank you.
Cool. I'm gonna turn it over to Amanda. Amanda's gonna give you a little bit about how all of this works. And thank you all for your attention. And really, really from the bottom of my heart, I appreciate you all coming this evening.
Great job, Doc. Thank you so much. And hey, everybody. Thank you again for attending our speaking series tonight. My name is Amanda Brown, and I'm the Director of Patient Services. And pretty much what I'm here to do is to help all new patients just kind of better understand what we do, and I guide you in that new patient process. Also, with the follow-up patients, I'll be also guiding you in your treatment plan and giving you and helping you with anything that you need within your care with us. Is there any questions in regards to our programs and pricing? Yes, how can I? Yes.
Yes, all of the above.
Okay.
Yeah.
So we offer 3 different therapies for women. We offer pellets, creams, and orals. For men, we offer pellets, injections, and creams. And for the women, we have programs that run about they run at about $190 to about $260 per month, depending on what therapy. And for men, the therapy runs anywhere from $190 to about $305 per month. We do give discounts for our firefighters, first responders, military, and doctor discounts as well. So if you guys are any of that, definitely you'll be able to get. And theme park, theme park, Disney's. What was that?
What about teachers?
I don't have one for teachers at the moment.
Retired law enforcement?
Yes, ma'am.
So it's per month, it's not per time that you get pellets?
So
say you wanna get on the pellets, and you're gonna get pellets every 4 months. Pay a
So-
monthly charge?
yeah, so how that works is we would get you started. For women, we would start you at $495 that same day. So $495 would cover your visit, your 1 hour and 15-minute visit with the doctor. It'd cover you to get started with your pellets that day. And most women need progesterone, and that would also cover your compounding progesterone as well. So that would get you started that day, the $495. And then monthlies for the ladies would be $262.50 for the first year every month. Now what you're doing is you're pretty much kind of putting the money in the pot, and you're getting your next pellet at when you come back in. But not only that, you're also going to be talking to the doctor in between the months, because you're going to need lab reviews. You want to make sure that your levels are getting up, so we want to double check that again. But we are a concierge office, so you also get unlimited appointments with the doctor in regards to your care. That's all part of what you do pay. Now, one thing I do want to tell you is that the first year tends to be a little bit more expensive, just because you're new to the office. We're getting to understand your body. After the first year, we sit you back down and have another 1 hour and 15-minute visit with the doctor to discuss how well you did. And then also talk about your goals, because we do set goals with all new patients that come in. After that, and everything is, you guys are doing well, then we bring you over to a lower cost. And for women, it's $199 per month at that point.
So it's an annual agreement?
Yes.
There's nothing monthly? or nothing?
You can pay, but you always have the option to pay a la carte and just pay every time that you wanna come in, you can definitely do that.
And what does that look like?
So your first visit would be $275.
And do you take insurance?
We do not accept insurance, and the reason why we don't is because a lot of the insurance companies don't cover the hormone treatment. So that's why we've created the programs and built in the doctor's time.
So $275 for the first consultation.
That's
and then
correct.
What visit after that?
It depends. So if you're gonna start with pellet therapy, I believe the pellet you could get started that day would be $450 for that
On top
insert.
of the two.
Yeah, because it would be separate from his
Sure.
from the doctor's fee. Yeah, and then it would be, if you need progesterone, then you would pay monthly for that. I believe for a 3-month supply of progesterone with shipping is like $170. Remember that is compound, so you are gonna get the best quality for the progesterone. You also are gonna have follow-up visits in between time, because remember, this is maintenance, so we need to continue to watch you. You need to continue to get blood work and in-office visits, things like that.
So for the first year, how much does it total cost?
$31.50 for women, first year. Second year is $23.75. Yes, ma'am.
Just a quick question. So, you actually start doing the pellets your first visit before the blood work is back?
Well, we would want to book you
Okay.
once that blood work is final,
Right,
because
okay.
the visit is so long and we want it to be customized to you. We definitely want to make sure we have all of our,
Absolutely.
yeah, or you'd be paying another you'd be paying another visit to come back. Yeah. Yes.
How often do you do the blood work then?
Blood works, are we talking about pellets?
Yeah.
Okay. It'll be, for women, it would be 6 weeks after every pellet insert, unless you're having complications. And remember, pellets for the first year would be about every 4 months. Pellets typically last about 3 to 4 months for women, about 4 to 5 months for men.
So you would always test blood again 6 weeks after pellets, every 4 months or whatever.
Yeah,
That's
yeah.
what you would
For the
do.
first
Okay.
year.
Absolutely,
Until
for the
you're
first
stable.
year, yeah.
So you know, so you're consistent with your dosage, and then you would go.
Absolutely.
Yeah,
Once
you-
we
you
get
don't
you at that
pause.
optimal level,
Okay.
less blood work at that time, but we still give you the time if you need it, and of course any in between, if we need to look at your thyroid, if we're looking at other hormones as well.
So the blood work should be covered by insurance.
Depends on your coverage, whatever your insurance, whatever you have, but typically we do see patients that, the blood work is covered, which is a positive, which is a plus, but we do have special rates that we can give you guys for cash prices if you need it as well.
We can give you the lab requisitions, which you can go to
Absolutely.
your insurance and check.
Yeah.
Which we
Always
encourage
recommend.
everybody to do. What we want is for your insurance to cover it, what we don't want is the insurance to deny it, and then you get an insurance bill, which is way more than what the cash price is.
Correct.
Yeah.
Yeah, they're not really nice when it comes to patient responsibility.
I have a
Yes,
question.
ma'am.
If we're gonna get blood work soon, cause I have to go, can you guys tell us what you guys test for, so
Of
that way we
course.
can- Okay.
Of course, yeah, I have requisitions in my office. I can just hand them out if you guys just want to see like the codes, the test codes, some of the CPT codes that we put on there. I can get that for you. Yeah.
So how much
Hold on one second.
that,
Yes, sir.
that blood work probably doesn't fall under like your yearly exam, does it? It's probably different blood work.
In my opinion, oh, absolutely, it would be different just because it's hormone specific. The annual is typically like CMP, CBC, maybe a TSH, maybe your cholesterol, cardio IQ, but we're looking at 14